Hello, today we are going to learn about Asperger's syndrome.
So, hello guys. Asperger's syndrome is considered to be a high-functioning form of autism spectrum disorder. Most individuals with this condition are of above average intelligence. However, their abilities to communicate and socialize are comparatively poor. Syndrome is a neurodevelopmental disorder characterized by significant difficulties in social interaction and nonverbal communication, along with restricted and repetitive patterns of behavior and interests. What Asperger's syndrome generally involves difficulty with social interactions, restricted interests, desire for sameness, and distinctive strengths.
Symptoms of Asperger's syndrome. The child may exhibit signs of social isolation even if it is not interactional. The child tends to fixate on a few topics about which they are greatly interested. Signs of Asperger's syndrome. Difficulty with social communication and interaction, hypersensitivity to sensory assaults, extreme focus on a specific topic of interest, difficulty with changes in routines, challenges with empathy, engaging in stereotype repetitive behavior. What causes Asperger's syndrome? The exact cause is unknown, but the Asperger's syndrome may result from a combination of genetic and environmental factors that cause changes in brain development. Asperger's syndrome tends to run in families, suggesting that some cases may be hereditary.
Diagnosis. The very young child with Asperger's syndrome may not be aware of being different from older children of his or her age. However, adults and older children will become increasingly aware that the child does not behave, think, or play like older children.
The role of the teacher. In addition, the role of the teacher in the classroom to diagnose children with Asperger's syndrome disease is very important. She or he needs to pay attention to the student behavior into the classroom. The role of the parent. The role of the parent is very important in a child with Asperger's syndrome disease because the parent needs to support and stimulate all the learning disabilities that the child can have. We need to keep in mind that a child with Asperger needs to be surrounded by people. In other words, it means that parents and teachers can have a positive influence in the child. Characteristics. Children with Asperger's syndrome have specific learning difficulties, such as intellectual or artistic interest, speech differences, delayed motor development, and poor social skills. Also, in characteristics, we have persistence, high integrity, and masters of routine. This is all of characteristics in a child with Asperger syndrome.
Social interaction. The lack of demonstrated empathy is possibly the most functional aspect of Asperger's syndrome. Individuals with Asperger's syndrome experience difficulty in basic elements of social interaction, which may include the failure of develop friendship or enjoy spontaneous interest. Language and communication. Asperger's disorder is on the basis of language development delays and or abnormalities in language functioning. Must be evident for a diagnosis of autistic disorder, whereas a criterion for Asperger's disorder is that there is no clinically significant general delay in language.
Are Early diagnosis or detection and proper management strategies are critical for Asperger's syndrome patients to function independently in society. You know, a number of respected historical figures had symptoms of Asperger's, including Mozart, Einstein, and Thomas Jefferson. Currently, there is no cure for Asperger's syndrome, but an effective treatment like the ones listed can improve how someone with Asperger's copes with social challenges, impulses, emotions, motor skills deficit, and others' behaviors that might be impacting their life.